So welcome everyone to our first fall presentation, I think, for our kicking off our series of webinars hosted by today is Elder Abuse Prevention Ontario, and we are co-hosted with our colleague, Canadian Network for the Prevention of Elder Abuse. Benedict, as you'll see on the screen, is co-hosting with us, and we're so pleased to have this partnership to continue our outreach, not only for Ontario, our audience, but across the country. So thank you for joining us, Benedict. Today's presentation is called Reimagine Aging, a program to counter internalized ageism. And we are joined by our speaker, Michelle Porter, who is the director for the Center on Aging at the University of Manitoba. Before we get started, I would like to provide our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Just a couple logistics before we get going. All attendees' microphones will be muted. As I mentioned before, we do have our chat box where people are welcome to post comments, and we do appreciate people making comments or sharing information that might benefit other individuals, but no negativity in terms of towards other individuals would be appreciated. That would be we'll go through some of the other logistics around that. Also, our question answer, if you have any questions that you think of now that you might forget or you want to ask our speaker as she's doing the presentation, please put that in the Q&A box, and we will be taking time at the end to answer your questions with Michelle. Benedict will be monitoring the Q&A as we go through. As I mentioned, we have our ASL interpreters with us today. And you'll see them on the screen. They will change periodically. Again, you also have the option of turning on the closed captioning on your screen if you want additional assistance with accessibility. And as most of our webinars, we always ask for your participant feedback to give us more information and suggestions for other future topics. So there will be a link that follows up after the webinar closes today, and we will be sending a follow-up survey, a link to the survey, but also a link to the website page where you can find a recording for this session as well. We will be posting lots of links. Michelle's given us some really great information to pass along to you that will be posted in the chat box. We will post those along with the recording on EAPO's site, as well as the Canadian Network website after the webinar. Give us a couple days to get that uploaded to our webinar, or sorry, our websites, and then you'll be able to access all that information. We do respect people's privacy and confidentiality at these public events. And we do understand that some people may be experiencing circumstances that they would like to discuss. We would like to encourage you to contact us offline if you would like to further discuss something personal in nature. You can reach out to either the CNPEA or EAPO, and our contact information will be available at the end of the presentation. So just to provide an overview for those who haven't come to our sessions in the past, our webinars, as I say, we do monthly webinars, and our vision really is to provide that education to individuals, but we want to make sure that seniors are free from ageism and abuse, where human rights are advanced, protected, and respected. And we changed our vision lately, I guess in the last 6 months or so, to include ageism because it's such an underlying risk factor for abuse. And we need to really address that. So we've really advanced the work that we're doing in that area. And we are mandated to implement Ontario's strategy to combat elder abuse. We have been implementing that since 2003, so about 21 years now. And we are funded, that program is funded through the Ministry for Seniors and Accessibility, where we're mandated and funded through that program. So we continue to do that, and a lot of accomplishments and outreach has happened as a result of the work that we've done over that time. I'd like to ask Benedict to introduce herself and her organization.
Hi, everybody. It's nice to see you all today for our first webinar of the new season. As Ryan said, I'm the Executive Director of CNPEA, which stands for the Canadian Network for the Prevention of Elder Abuse. Someone actually asked about those acronyms in the chat box, so this is who we are. And we are a pan-Canadian organization that operates virtually out of Vancouver, but across the nation. And we work to improve awareness, support, and capacity to develop a national coordinated approach to elder abuse and neglect. So we do this via knowledge mobilization, collaboration with organizations such as Ryan's Elder Abuse Prevention Ontario and others across the country and across sectors, policy reform and education. And just like EAPO, our vision is that all older people in Canada can have access to the services and supports that they need so that they can have a good quality of life and live without fear of violence, neglect, or ageism. We'll add that to the mix. It's a pleasure to see you, as I said, and if you want to find more information about CNPEA and about elder abuse, you can find our website, www.cnpea.ca, or you can find us on social media as well under CNPEA.
Thank you, Benedict. So now it gives me great pleasure to introduce our speaker for today, Michelle Porter. As I mentioned, she is the director for the Center on Aging at the University of Manitoba. As you can see from her long bio, she has a lot of credentials and work and experience that she has done in the area of health and aging. She's been at the Faculty of Kinesiology and Recreation Management at the University of Manitoba since 1998. She's held positions as the director at the center since 2015. Her research career has varied, including topics of neuromuscular physiology, physical activity, as well as driving and aging. Her current age-related work spans ageism, age-friendly environments, and mobility and aging. And she's also a fellow at the Gerontological Society of America. So welcome, Michelle. We are so pleased that you're able to come. I'm going to stop my screen and allow you to present your material. Again, for people, just a reminder to put your comments in the chat box. And if you have any questions for Michelle, please put them in the Q&A box and we will address those at the end of the session. Thank you.
Thank you very much for that introduction, and thank you everyone for attending today. So fantastic to see so many people who are interested in this topic related to internalized ageism. And thank you, Ryan, for making all of the arrangements for this webinar today. So I'm going to start by letting you know the fact that my co-presenter unfortunately was not able to attend today. He has just started a PhD program in clinical psychology here at the University of Manitoba, and one aspect of his schedule got changed, which does not allow him to be here, which he's very disappointed to be missing this. Dallas started out being hired as a research assistant to work on this particular project. He became so enthusiastic about it that he decided to make it the topic of his master's thesis. And so it went from being a project to develop and implement a program, had a lot more research elements added to it. And if you want to see more about those research elements, you can see a couple of the articles that have been published. The full text versions are available and you will get access to those links. And Dallas was the first author on both of those papers. So I just want to acknowledge all of his work on the project. I'd also like to acknowledge the University of Manitoba campuses are located on the original lands of the Anishinaabe, the Inunuuk, the Inisinuuk, the Dakota Ayate and Dene, and on the national homeland of the Red River Métis. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. I'd also like to acknowledge first off the funder of the program development. So we were lucky to receive funding from the New Horizons for Seniors program a couple of years ago to both develop the program and implement it. And in fact, there's kind of double acknowledgements for New Horizons in that a previous project that was funded by them really led to the idea behind the development of the program. So we had previously received funding to offer workshops related to communicating about aging. And in those workshops, what we heard from people after we gave them information about how to communicate appropriately, what kinds of messages to use to combat ageism, what we heard from a lot of people in terms of the things that they were going to do after the workshop was they were going to rethink their own aging because they realized themselves that they were thinking about it in kind of a stereotypical way. So that kind of became the germ of an idea for us developing this program. I'd also like to acknowledge co-authors on the research articles, Dr. Corey McKenzie and Dr. Judy Chipperfield, both from the psychology department at the University of Manitoba. And we also want to thank the advisory committee that gave us input along the way on this project in terms of what kind of content would be, what the title of the program should be, logistics of how we should offer it. So really want to show our appreciation to three important organizations in Manitoba, as well as a couple of other colleagues from the University of Manitoba who provided us with important input. So I'm first going to start off with just kind of giving some background information that will set the stage for talking about the program. So first, to start with some definitions. So ageism as a term was actually coined back in the end of the 1960s by a prominent gerontologist in the US. And you can see the wording was quite different back then. But a current definition that is used quite commonly now globally comes from the World Health Organization, the WHO. And their definition is that ageism refers to the stereotypes, that's how we think, prejudice, how we feel, and discrimination, how we act towards others, and notably oneself, based on age. It's important to point out that this definition is not specific to older people, although usually we think about ageism as affecting older individuals. It really can apply to anyone of any age if all of these things are happening exclusively based on age according to their definition. But for the rest of the talk, I'm going to be focused on ageism and how it affects older individuals. So it is really becoming more widely recognized that ageism can affect society in a variety of ways. And so lots of organizations have recently taken up anti-ageism campaigns. So the World Health Organization itself has ageism as part of its global strategy and action plan. And in fact, combating ageism is also part of age-friendly initiatives. And of course, there are many entities in Canada that are also doing things related to ageism. So the Government of Canada has some reports and consultations. My province, for example, in their strategy on aging has a specific plank related to combating ageism. And of course, there's many other organizations, including the Canadian Coalition Against Ageism, which Elder Abuse Prevention Ontario and the Canadian Network for the Prevention of Elder Abuse are both part of. So it is becoming more widely recognized, even though the definition came out in the late 60s. Really, it's only been recently that it's become such an important topic. I think a lot of us realizing until we deal with ageism, we really can't deal with a lot of other things that are affecting older individuals. If you want to learn more about ageism, this is a great place to start. The Global Report on Ageism, which was put out by the World Health Organization. It gives background information as well as provides a framework for action and recommendations for different actors. And importantly, the World Health Organization has done some work to look at ageism as a global issue. And they have seen from their surveys of 57 countries that 1 in 2 people could be determined to be ageist. And in fact, many countries on the whole were found to be moderately or highly ageist. So here's some information or examples of different forms of ageism. So we can think about ageism in different ways. So one way is unconscious or conscious ageism. So unconscious is just things that we aren't even realizing as individuals, say that we are being ageist. There might be thoughts that come into our mind based on something that we hear or see, and we're not even really aware that our thinking or maybe our actions are actually ageist. And then there are examples of things where people are clearly knowing that what they're doing is ageist, but they do it anyway. Ageism can exist in interpersonal situations, so between individuals and social networks. So say, for example, within families. It can exist at an institutional level. So for example, a very prominent computer company was charged with ageism because they were trying to basically get rid of any employees that were older than 40. We see a lot of ageism in the culture around us. So whether it's in comedy skits from late night shows or just in the newspapers, radio, etc., all of these things contribute to cultural ageism. Ageism can also be benevolent. So in this case, it might be done with good intentions and it might actually be perceived as positive by some individuals, but in fact, it might be over accommodating or paternalistic. So helping somebody when they don't really need the help, or as one of my previous types of research was related to older drivers, suggesting that someone shouldn't drive anymore to keep them safe, just based on their age, not based on whether they're a safe driver or not. And then the exact opposite of benevolent ageism is hostile ageism. So this, as the term would suggest, is highly negative. And an example here would be the hashtag during the pandemic, boomer remover, where people seem to have some sort of glee with the fact that older people were dying of COVID. And then the topic that we're going to focus on more today is internalized or self-ageism. And I just want to congratulate you for coming up with a great picture that was used for promoting. I think this is a great one. It's really hard to capture in a picture what internalized ageism is. So I want to congratulate you on that. So in terms of general effects of ageism, one is that the lives of older people can just be devalued. Older people are not felt to have the same worth as other people just based on their age alone. This, amongst other things, could lead to inappropriate policies and programs, or just even ones that completely ignore older people. There might be lack of work opportunities or training opportunities at work. There might be reduced access to healthcare or different types of treatments. Poor quality of life and well-being could result. There could be poor social relationships. And another example is the exclusion of older people from research. And again, even in the pandemic, where we saw that this virus specifically had very negative effects for older individuals, some of the first trials testing vaccines did not actually include older individuals. So now to the topic for today, which is internalized or self-directed ageism. So in this case, after potentially decades of exposure, older individuals may unknowingly start to direct these age stereotypes inward. So all of those things that I've mentioned before, they exist around us in society. We're kind of immersed in an ageist world, so to speak. And it might become even more issue because of the length of the exposure, and also because although there's lots being done to try and change this, there still isn't a lot of public discussion around ageism being an issue. And in fact, when some research has been done on this, people have suggested that it really isn't much of an issue. Hopefully that will be changing as we speak. So internalized or self-directed ageism can clearly affect the self, so it can affect the individual, but it can also affect older adults' perceptions of other older people. And so this also is problematic because older people might not see that programs, policies, et cetera, might be needed for other older people because they're fine, for example. And the consequences of internalized ageism are also pretty negative. So what we can see is that people might be less likely to adopt health promoting behaviors, or they might be more likely to engage in risky behaviors. And this could be because there's a lot of fatalism associated with aging and people's thinking, and thinking that there's really not anything that can be done and everything about aging is just negative. As a result of this and maybe other things, poor physical and cognitive health can result. People might retire earlier than they want to or they need to because they think they should, again, just solely based on their age. People might limit their taking up of new activities like using technology because they just think they're too old. Some studies have suggested that people who have more internalized ageism are more likely to have ideas about committing suicide. Social isolation or loneliness might result if you start to internalize some of those thinkings about aging. You might then really not want to engage with other people who are either your own age, older adults, or who are younger. And we all know that there are very negative consequences associated with social isolation and loneliness. And then perhaps most dramatically, studies have shown that longevity actually can be affected. And in one of the studies where people were followed by 23 years or over 23 years, this was up to 7.5 years. So people who had more internalized ageism lived 7.5 years less than those who did not. And as would be suggested by the organizations who are organizing this talk today, elder abuse certainly is thought to be associated with internalized ageism. More research is needed to be done here, but one could see that if you start to value yourself less because you're given so many messages that older people are not have as much worth as other people in society, that could make you susceptible to elder abuse. I'm not going to go through this whole list, but as I mentioned, there's a lot of negative thinking about aging that exists out in society. We rarely hear about the many positives that are associated with aging, things like people are more likely to volunteer, they might be better at solving problems between people. There are actually some improvements in some forms of memory. and even dementia is much less common than people might actually expect. So these are some of the things that we put into our program, really to get at what is the subtitle of our program, which is aging. Is it the worst of times or the best of times? So a lot of people in society think about getting older as being the worst of times. And I guess that list before was just to suggest that there's a lot of great things about aging, besides the fact that the alternative isn't wonderful. So now I'm going to go through information specifically about the Reimagine Aging program. So one of the main things about it was to try and reduce internalized ageism, specifically within older individuals themselves, and really to help people to reimagine their own aging relative to their personal situation. So to really think about their own aging on an individual basis, rather than thinking about it based on what the stereotypes are given their age. So the format of the program, it was done real time on Zoom. So we had in some sessions about 130 people engaged with the program, which was logistically a lot of fun because we had breakout groups, but we managed it and it actually went wonderfully. So the program ran for 6 weeks with one session of 90 minutes per week. The sessions involved educational videos. There were individual activities for people to engage in, as well as those breakout discussions that I talked about. And then in between sessions, individuals actually had homework or assigned activities and bonus activities that they could engage in. But notably, we did not have any exams associated with this program. So in the first session, we really wanted to provide some education about what ageism is. Again, about some of those positive perspectives on aging, so to kind of counteract some of that negative thinking that's out there. We really wanted to start to build the skill of mindfulness, building people's awareness of things around them, which was important for them in one of the activities we gave them, which was noticing ageism. So we asked them to notice ageism around them in between the sessions. And then in the second session, kind of a similar setup, we wanted to provide education about what internalized ageism is. What are the consequences of internalized ageism? Another skill was developed here, which was separating yourself from unwanted ageist thoughts. So we know that, as I said, there's lots of these unconscious things. We're immersed in this ageist society. So most of us are going to have ageist thoughts, but being able to recognize them is really important. And then we wanted them over the course of the next week to really notice internalized ageism in themselves, as well as people around them. In the third session, it was really delving into stories that they were telling themselves about aging. We actually had asked them to come up with a narrative about what they thought their aging would be before they started the program, how they could really start to try and reimagine their own stories of aging. And then another skill was taking perspective on what it means to age. And then when we got into the fourth session, this is really getting into some of the nitty-gritty things to really counteract that internalized ageism. So the first concept here was really thinking about control. What is it that people can control and how can they change things based on that control? And then how can they accept what they cannot control? Participants were specifically taught to avoid saying they can't do something because they're too old, and to really think about, if they can't do something, is it because they're too old, or can they actually do it? Or is it that they can't do it because of some other reason? And then are there ways that they can find to adapt? And then finally, some things you just can't necessarily adapt to, and we gave them skills to try and become more accepting of those things that they cannot control. In the fifth session, they were brought through activities to identify their own personal values. And then they were to construct their own personal definition of aging well that's free from ageist messaging. In the sixth session, this is where they were to come up with goals and behaviors, again, their own individual ones that lined up with their individual values, as well as their personal definition of aging well. So everything about this program beyond the first kind of background sessions was really about the individual, because we know that people are all aging differently. There are some commonalities, but within the older population, we see a huge amount of heterogeneity in people's abilities, their wants, their needs. A lifetime of factors has affected people. And so really all of these things need to be very individualized. They were also taught in this final session ways to attain their goals and also successful ways to go about behavior change. So those were the six sessions that people went through. And as part of this project, I mentioned that Dallas did his thesis on this. So we were really able to go through some intensive research elements with some of the participants of the program. So we had about 75 to 80 people who took part in the research part of this. And we also got feedback from the other participants. So there was a lot of enthusiasm for the program. The feedback was positive on the content in general and the effects on individuals. So we did ask the research participants how useful they found the program, and on a scale from 1 to 5, with 5 being the most useful. And you can see that in general, most people found the program to be very useful, and that built across the program, with the last 3 sessions being the most useful to individuals. In terms of engagement with the program, 81% of people said they completed assigned activities, and 80% of people completed the bonus activities that we weren't suggesting that they had to do. So we felt that based on people attending the sessions as well as doing these activities, there was a great engagement with the program. We also asked people whether they changed any of their behaviors, because that was the ultimate goal of this. And we saw that people, one, felt that it did change their thoughts on ageism and internalized ageism. 89% of participants said yes. And we saw in the 2 weeks after the program, 60 participants reported that they had changed some sort of behavior. And 2 months after the program, again, 60 participants reported behavior change. And I don't have a lot of time to go through a lot of examples here, but we did have people who said that they decided to take up a university degree. We had someone who decided to go to an open mic comedy show and participate in that. They said they never would have done it in the past because they would have thought they were too old. Someone went on a trip by themselves and they never thought they would do that. Someone decided not to retire because they felt that as a result of taking the program, they realized that they didn't need to, and that made them feel great because financially they didn't know how they were going to deal with their retirement. So we really saw a lot of great outcomes. I must admit, when I was reading through some of the responses to this question, I really had tears in my eyes with some of the answers. Also, part of this research is we wanted to see whether it actually had the effects that we thought on internalized ageism. So we found that their self-perceptions of aging became more positive. we also found that their perceptions of other older adults also became more positive. So those were the real kind of research targets of the program, more measures taken from surveys. And then we also wanted to see what was explaining the changes that we saw in the self-perceptions of aging and the perceptions of other older adults. And these were some of the targets of the program, some of the things, the skills that were being taught. So we saw that psychological flexibility, kind of that willing to be open to change, mindfulness, being aware of kind of things that are going around you, and perceived control. So knowing what you're in control of, these all help to explain the self-perceptions of aging and the perceptions of older adults. So it seems like these program elements were beneficial for having positive effects. Since offering that initial offering of the program, we did get funding from the Manitoba government to offer the program in person, because of course we realized that not everyone is able or wants to participate in an online program. So we worked with many community organizations across the province. We provided them with all of the educational videos, activities, and breakout group discussion topics. And then they found a facilitator and space so that people could meet in person and go through the program. We also, through the funding from the province, offered an online on-demand version of the program. We did a pilot of this using a learning platform called Learn Worlds. And so all of the same educational videos and activities were used, but in this case, there were no breakout group discussions. Individuals did the program on their own, and so it was self-paced. So they could do it quicker or longer. There really wasn't a set schedule for them. And so from that, we evaluated both of these programs. They weren't research projects, but we learned a lot from the facilitators as well as the participants of the in-person program and those who were engaged with the online on-demand program. So in terms of future offerings, well, first, we really want to do a research project. While the findings are really promising and we feel ultimately that this would be something that would be a great program to offer everywhere, we do feel like we want to make some modification based on the feedback that we've received. But we really need to compare the Reimagine Aging program to a similar yet not using the same kinds of skills or education components to a control program so that we can really test it in a vigorous way. This is kind of your typical research approach to make sure that a program is effective, is to do a randomized controlled trial. And so we are in the process right now of trying to get funding to do a randomized controlled trial. But ultimately, as I said, we hope that this program could be offered everywhere. Certainly, we think it could be something that would be available on demand, online, on a learning platform, but it could also be offered in person, the way we did in Manitoba, and it could also be offered via Zoom, because we did find that that was effective as well in research. And so we really hope in the future to be able to work with other organizations to ensure that this kind of a program that seems to be very effective against internalized ageism, that it can be offered in lots of places in Canada and worldwide. So if you would like to hear more about the program in the future, I would encourage you to email us if you're an organization and you think you might like to engage with the research or future program offerings. We'll be very interested to hear from you. And with that, I will conclude my presentation and I'll be very happy to answer any questions that you might have.
Thank you so much, Michelle. So I was taking a minute here to review the questions that were sent while you were speaking. There were quite a few. I think you've kind of touched a little bit on some of them because we had a couple of questions about whether people from outside of Manitoba could technically participate in this program. So let's start with that. Is it open to anyone or just to people in Manitoba?
Our first offering, we actually had intended mostly for it to be in Manitoba, but we did have some people from other provinces because it was online, so people could participate from anywhere. And certainly with our next iteration where we're planning to do a research project, we are thinking of that as being a Canada-wide process where we will be recruiting people from across the country, and we'll actively try to recruit people from across the country. So yes, it is something that we are anticipating would be broadly available, not just in Manitoba.
That's great. And in terms of organizations that would like to have access to this program and to maybe implement it or, lead it where they are, is it the simplest way? Is it to email rethinkaging@umanitoba.ca?
You can email us there. I will say, though, we're not ready for kind of broad offerings of the program yet. As I said, we really do want to make some modifications. We do want to do that next level research project so we can be assured that the effects that we saw were truly attributable to kind of the elements of the program and not just that we were offering any program. So that's really important from a research perspective that we do that. So we're not quite ready yet for other organizations to offer it, but we certainly hope that that will be possible in the future.
Great. And I believe I've also shared a link or an email address for people who want to receive your email newsletter and kind of stay on top of what's the developments about your work, which is great. We had a question regarding the age range of the participants for the project, as well as the gender breakdown. Did you have, because age, is a pretty wide spectrum of ages. Do you have a sense of what the breakdown was for the participants?
Sure. So when we advertised it, we actually left it quite open, although for the research project, we specifically had it for people 55 and older. We did have a lot of people who were in their 60s and older. We had, I believe, some people into their 90s who were taking it. One thing, and this is pretty common, I think, for people that offer programming for older adults, is that it was heavily female dominated. So even though we tried, you could see that at the beginning, I acknowledged men's shed. So we did anticipate that it might be challenging to have men signing up for a program like this. So this is something that we will need to address going forward with future research, is really doing as much as we can to try and get men into these programs. But I think this is a pretty common phenomena with a lot of programming for older adults, is that women are more likely to participate.
And speaking of women, there was actually a question asking, do you find evidence that women are more likely than men to internalize ageism?
I don't know that we saw that, but we weren't really able in our specific research project, because we had so few men, to be able to really tease that out. But one could see that certainly from a culture point of view, that, sexism and ageism do intersect. And there are certainly examples where women are affected by ageism more. I guess one of the things that's probably been in the public that would really bring attention to ageism was the whole episode with Lisa LaFlamme and CTV. Still not sure exactly what happened there, but ageism specific to women was certainly brought up in that example. And so one could see that there might be circumstances for sure where women might be more susceptible to both societal ageism as well as internalized ageism.
Great. And we have a couple of questions regarding maybe adaptation in different languages, whether French or Punjabi or other languages. Is this something that is in the works or that you hope to accomplish?
So far, we have been working with someone here in Manitoba to translate it into French. We probably won't do too much more translating until we make some more modifications to the program. We did in our in-person offerings, we had some suggestions. One of them was to make it a little bit shorter, maybe 5 sessions instead of 6 sessions. That might encourage more people to sign up for it, and people felt like that would be a good amount of time. So certainly, you know, for widespread offering of the program, that would clearly be an important thing to do, would be to translate, and that could be something that we could work with organizations to try and get funding to do that, because of course, translating things is not that simple. Although there are more tools out there, we actually did use an AI platform for doing some of the translations, but not all of it works, so you can't rely on those kinds of systems.
Indeed. It's too bad. Maybe we'll get there soon. There's a question about the sort of, there's a vicious cycle of if you are already socially isolated and ageism makes you, or self-inflicted or otherwise makes you feel even more isolated, how do you reach these people? This sort of, how do you recruit participants to kind of break that social isolation and help them, grow out of that isolation a little bit?
Right. I mean, I guess this is a classic question for almost any programming for older adults is how to reach people. I mean, I think one of the things that we've been thinking about and have already attempted to do is this variety of offerings. And so having online, and while not everyone is able to do online programming, that certainly is changing. If you look at Statistics Canada data, the proportion of older people who are using the internet just continues to climb. And so that's a great way to do it. I guess a lot of this would be relying on those community partners in reaching individuals. So yeah, I think probably a very multifaceted approach would have to be used. But I think having these multiple ways of taking part in the program, including kind of the online on demand, where if you're not comfortable with interacting with other people, that program lends itself well. And perhaps as a result of the program, though, someone would engage more with other people. And we did see with some of the change behaviors, we did have people saying that they were getting out and joining groups, that they were, even just connecting with their family members more often than they had in the past. And so as a result of the program, again, it's getting people to it, but as a result of the program, we did see some changes there.
That's really great. That's actually like I understand what you mean when you were saying you were getting tears in your eyes reading the answers and the results. That's a wonderful thing to witness. There's another question here, kind of looking again at this idea of, aging or older people as a rather wide bracket. It, covers quite a few decades worth. Do you consider the age with that project, like whether somebody is, say, 58 or 78 or 88? Is there an age bracket that is more or less affected? Like, what's the relationship between the specific age and the experience of ageism?
I believe we saw a bit of an age effect, so that older individuals it affected them more. And some of that might be related to age, might be related to cohorts. So, of course, different cohorts have different thinking about aging as well. And so I don't think we have really enough data right now, but I think in some ways, oldest individuals might have the most to gains, because if they're in their 80s, say, there's a lot of stereotypes about what someone in their 80s, shouldn't be doing, kind of thing. And that a lot of that even comes kind of in that paternalistic people trying to be helpful way from, children, other friends, et cetera. And so it seems like possibly there could be more to gain, but it really depends on where people are starting from. And so we did see that people who had more internalized ageism thinking, didn't do as well on kind of psychological flexibility, control, mindfulness to begin with. They were the ones who saw the most to gain. So over time, with larger samples, we might be able to delve into these things more.
Thank you. We have a few more minutes, so I'm just there's many more comments and questions that have been pouring in, but somebody's asking, and it's an interesting one, could this program be run within agencies as a form of professional development? And do you think it would work as well with employees that are younger than 55? Would it be worth it, and could it work?
In terms of the ages, I mean, I think this could be beneficial for anyone of any age. We particularly were thinking about older individuals, but, people in their 40s, 50s, equally could be thinking. I mean, you hear lots of people in culture, I'm now in my 40s. So, this could be done really with anyone of any age. Examples might be a little bit different, but I think that's important. In terms of agency workshops, certainly, I've been doing some workshops with agencies, not so much on kind of taking people through their own individual journey, but really providing information about internalized ageism, because I think a lot of people are quite aware of ageism who work within kind of the gerontology or aging field, but I'm not sure as many people are aware of internalized ageism and the potential consequences of internalized ageism. And so I think, yes, a lot more needs to be done there in terms of providing education. I mean, I think there is a lot that needs to be done within agencies around ageism just generally, but internalized ageism for sure. Whether it would need to include all of the components of our program or not, I think just even like something like this, learning about all of the different ways in which we approached it and what kind of elements affect it, I think those kinds of things are important for those who are working in the field.
Yeah. And we have a question from someone asking, has there been any interest from the Manitoba Public Service to support or do these workshops? Or is this maybe too early?
Perhaps I have been, I'm not sure about the public service specifically what's meant by that. So maybe if there could be a little bit of more information. We have been trying to get additional funds from the Manitoba government to do some more follow-ups while we're waiting to get funding to do our research project. So far, we have not been successful with that. I have also approached the government, and I think there's interest, but so far no funding, to do more of that kind of continuing education, professional development with professionals, regardless of whether they work in, specifically a senior serving field. I think there's lots of work that needs to be done across all sorts of professional groups, whether it's healthcare workers, people who work in government providing services for older people. I mean, I just think generally we are ageist against older people as a society. So a lot of work needs to be done in a lot of different areas.
Yeah, and the absence of awareness of this issue leads to more ageist policies, and round we go.
Yes.
We had a couple of questions that kind of were touching on the intersectionality of it all, where you did you involve, or were people with disabilities involved in the program? Was the program designed with, this idea of finding ways to reach out to older people living with disabilities? And similarly, did you reach out to a specific cultural and ethnocultural communities?
We did do that. I will say we had a very short window of time for our very first offering, which was the research project. As those of you who get New Horizons funding know, you've got a year to do your whole project. And so we didn't have a huge amount of time, but that's certainly something that's built into our research project to do a lot more of trying to recruit a very diverse group of people to participate in the program. When we went to the provincial project that we did with the in-person offering, we did have a variety of different groups. And certainly we do hope to have, you know, as I said, a very diverse population. And I think it is, you know, suitable. I think we've had some questions about whether it's suitable at all for some cultural groups, that, you know, ageism doesn't exist. But I'm not aware of any culture where ageism does not exist at all, and where there wouldn't be internalized ageism. And even if someone is in a situation where within their own community there is no ageism. Again, I'm not sure that that exists, but they exist within the broader Canadian society where we know that ageism does exist. So certainly we do need to do as much as we can to try and recruit a diverse sample.
Right. And I think based on the comments and beyond the questions, there are also lots of people expressing interest in either supporting the program, whenever possible, applying it in their own organizations. And I believe we have Dr. Olive Bryanton in PEI, who was wondering if you were looking for support from other universities for future research in the field. So I would expect that you will hear from a lot of them via the email addresses that were shared in the chat box. We've got 5 minutes left. I guess last question for me is, are there specific resources that you would point people to learn more about internalized ageism, and to also maybe do their work of talking about it and raising some awareness about it?
I don't know that there's a whole lot of like toolkits out there right now. I think, you know, if you want to look at the journal articles, I think there's a lot of great information in preparation for this. I was reading through the feasibility study article, which I believe you're going to or have already got the link for. There's a lot of great information there. But I don't think there's really any organizations right now. Internalized ageism has not been studied very much relative to other forms of ageism. So in terms of general places to look for information related to combating ageism, the WHO, the World Health Organization, their global campaign to combat ageism, they have a lot of information resources there and some best practices. So I'm not sure a lot of it focuses on internalized ageism. It's more ageism, you know, younger to older people, vice versa, that kind of thing, not so much on internalized ageism. It's really, we're quite at the beginning of doing internalized ageism work.
Yeah, it is. It is still an emerging topic, surprisingly. And I'll add to this mix because you mentioned them at the top of the event, and CNPEA and EAPO are both part of the Canadian Coalition Against Ageism, which is really kicking into gear this year again, because October 9th is Ageism Awareness Day. So this is still a newer, relatively new Awareness Day that was initiated in the US, but that is being picked up across the world. And the CCAA, Canadian Coalition Against Ageism, is embracing it this year. So I would suggest for people who are interested in learning more about ageism in general, and I believe self-applied ageism as well, if you want to be a part of something and kind of start, you know, raising some awareness in your surroundings with your contacts, you can support the campaign. You see it on the screen right now. I'm going to put the link in the chat box as well. So this is going to take place. The campaign is going to run from October 1st, which is National and International Day of Older People, all the way until the October 11th. With, of course, the culmination on the 9th for Ageism Awareness Day. So CCA has created promotional materials about ageism that you can download, that you can share on social media, by email, however you see fit. I highly encourage you to go see their website and learn more about how you can be a part of it. It is a first step in the right direction for all of you who are feeling motivated by today's presentation. And you'll hear more about this from EAPO and CNPEA, of course, in days to come. Rayanne, I want to leave you a couple of minutes, I think, to, well, first of all, thank Michelle and Dallas, even though he couldn't make it, and also maybe talk about our next webinar.
Right. Yes. Thank you again for Michelle for the great presentation. And you know, like we were just all the great questions too from our attendees today. Just a wealth of information that you shared, because we are really focusing on the internalized ageism. We do talk about the ageism to others, as we've talked about, and so this is kind of, you know, sort of a new area that I think is gaining traction. So I appreciate you taking the time to share your project and your program, because I think there's a lot of, just looking at the chat box, there's a lot of people who are going to be contacting you about maybe the adaptability of that when it's ready to be changed or shared across different jurisdictions where people live, and to, you know, help you know, change the perceptions internally and as an activity people can engage in. So thank you so much for sharing, and send our best to Dallas for all the work that he's did on this project. So and thank you, Benedict, for taking all the Q&As. That was there was a great dialogue, I think, during this session around this issue. We do have another webinar coming up next week on disclosure and reporting of abuse against older adults. And we have our guests also from the West. So Christine Walsh, who is a professor at the Faculty of Social Work at the University of Calgary, and her colleague that she works with, Kirsten Roger, who is a professor at the University of Manitoba. They'll be presenting that webinar. And I can tell you we have a great draw. That I think we have over 700 people registered. We do have a max, so if you are interested in registering for that, please go to our website. We do have, both of our organizations are promoting that, and to get registered early before space runs out. So thank you for coming to these webinars. We do appreciate it. We are also hosting another webinar. I think Benedict had just mentioned around October 1st is International Day of Older Persons. We're hosting an event on the 3rd, and that will be a follow-up to a couple other webinars that we've been doing on the UN Convention for the Rights of Older Persons, giving an update of where we're at. We've made some significant strides in this past few months. So we'll be giving an update, and we'll be partnering with the International Longevity Center from Canada and the Global Alliance. We have a panel of speakers that will be presenting, so stay tuned. The webinar speakers have been posted on our website, but we'll be doing more promotion in the days to come. So look out for that as well. And again, just that nice reminder about evaluations. We do appreciate it. It is only, I think, 7 to 8 questions. It doesn't take very long, less than a minute, I think, to do that, little check boxes. Thank you all again for attending our webinar. We really appreciate it. And to our ASL interpreters who have been patient in providing their great expertise and service to us again today, and to our partner with Benedict, and thank you again, Michelle. And just as a reminder, it will take us a day or two to get the webinar recording up on our websites, so bear with us, and we will send you a follow-up email when that link is available through our through the Zoom email, letting you know where you can find that resource. And again, a reminder for the survey link. So thank you all again, and everybody have a great day.
Thanks, everyone.